For reaction to Dr. Mkhize's briefing, and those experts were joined by chairperson of the South African Medical Association, Dr. Angelique Coetzee. Very good evening to you, and thank you so much for speaking to us.
Thank you so much, and good evening to all your viewers out there.
So in broad strokes, what was your takeaway from that press briefing?
We are very, from SAMA's side, we're very glad that the Minister and the Prof. Slim Karim and CRISP was open and honest tonight by bringing the facts to the nation, as we, as doctors, has already noticed that the last 2 weeks that the presentation of patients to the surgeries and in hospitals are different than in the second wave. And with the and we were wondering about this, as it is not what we expected, because remember we all learned from the first wave, and therefore we thought it would be the same, but it's not. So, and I think it's extremely important to understand that there is a mutation and there's another variant from the COVID-19 virus.
Can I just stop you there, Dr. Coetzee, to just once again repeat for our viewers, perhaps who may have been away from the television or out of earshot when listening to that careful explanation, because Dr. Karim did emphasize that we shouldn't call it a strain, that it's a variant. So please, just in layman's terms, explain what a variant is and what does it do to the genome sequencing, and how does it manifest for you and I to understand?
Okay, I'm not speaking to scientists, I'm not speaking to the average person out there that I think it's important that they understand. So it is a different variant of the first one. They have different names. They all have the same family name. Well, that's the easiest for me. It's COVID-19, but under COVID-19, you get this V501 strain or variant, and he also has a brother and a sister that's called something different, and it depends on where they go and how they attach to the cell and get into your little cells in your body and what damage it's going to do there. And important that it seems as if your antibodies have difficulties in curbing this new different type of family that now comes in, or this different brother, sister comes into this family. And this is like the black sheep of the family. You know the others, you know how they behave. You can fairly say, okay, this family will do the following. But this black sheep, it's got different clothes that he's wearing, a cloak. So he puts on the cloak of a 501, and your body's antibodies is difficult in seeing it.
You know, I did ask the question because I also wanted us to get an understanding, because we talk about strains, we talk about variants, to understand the difference. And I was asking if it's possible to get more than one, and the reply was that no, you can't, but the difference is that in this case, you don't know the behavior, as you've just said. So what do we do now? Are we extra cautious because we don't know the behavior of this black sheep in the family, as you've said? So they're siblings, but we don't know just how far this one will go.
Yes, you have to be careful now. You now need to watch this black sheep of the family. You need to make sure that you keep the doors locked, that you put the money away. So what you do, you know for a fact that this black sheep has got one problem, and it still needs a warm body. But the mask, the social distancing, good ventilation, and sanitizing is still the way to catch this black sheep. So it doesn't matter, he's still part of this family. But he hasn't got around these 4 things, how to get around that. And if this is the most important message, take-home message for each and everyone out there, please keep on doing these 4 things. Because if you don't, this black sheep is going to cause havoc in this family. And you might be a victim of this.
And we
So
heard that
we have to be
there are
careful.
a striking number of variants in or mutations in this new variant. So let's then now go to explain that further. Does that mean, in the analogy of the sibling of COVID-19 that you described, that this sibling is impetuous, is you know, very hard to read, cantankerous, so to speak?
Yes. Now, this same black sheep also can change himself. Remember the cloaks. He can wear different cloaks, and it makes it difficult for your antibody system or your body to recognize it. You are used to that you always wear a red cloak, and now all of a sudden he wears a blue cloak. And how does the antibodies then determine and see him and fight him? It becomes extremely difficult. So this is one of the things that the scientists are now going to work on, to see whether the vaccines that's currently out there will be able to detect if the virus wears different clothes or clothings, so that you can make sure that you can nab him and that you can get him.
Okay.
And that it doesn't cause any more havoc.
So let's explain this then further. The spike protein that surrounds the virus and allows it to bind to cellular receptors and infiltrate cells. What do we mean by this?
Exactly what you have now described. It means the virus comes in, it's got proteins around him, it goes in it goes and knocks on the cell, or binds on the cell. It loves the ACE2 receptors, exactly the same than the rest of the family, but it causes more inflammation. It seems like this at this stage. And now, because of that, because he's different, wherein his other family members are still there. Do not forget that, or don't for one moment think that COVID, the virus variant that causes the first wave, is gone. He's still there. He's just not as aggressive as he's the rest of, you know, as this black sheep, if we can keep on calling him a black sheep, him or her. So then what happens is, where in the past the younger people was not really that sick, we are now seeing that people, especially overweight people, round about the age between 20 and 30, are also now lying in ICU with severe inflammation from this virus. And we need to be extremely vigilant. We have said before, patients will not even know, a lot of them won't know that they do have COVID-19, but I must warn and say the symptoms is a bit different. It can catch you out as a doctor, even as a patient. It can become a super spreader, which will have devastating consequences for people around you with certain disease illnesses or with certain characteristics as overweight. And so we cannot now say that young people are safe. And this is a great concern to us. We need to make sure that they adhere to the 4 things. I call them the mantras, the mask and all of that. Please, that is all that we can do. The treatment hasn't changed. The treatment stayed the same from the first wave up until now. It's the same treatment. It's the same precautionary measurements that everyone must take. And I know we are all so fed up with hearing COVID, COVID, COVID. But please, we cannot let our guards down.
Now, just with regards to young people, the Minister mentioned that those in the region of 14 to 19 years old, accounting for the highest number of infections that we're seeing in the second time round, the second wave. Does it have anything to do with an underdeveloped immune system? Because I know that the older we grow, the more immunity we gain against certain diseases, whether it's inoculation or just developing antibodies.
No, this is part of the virus changing its genomes or its coding. So that this is part of that cloak that I'm talking about that is wearing, is changing it, and we didn't expect this. It's not common, only common to South Africa. We have seen that there's high increase of numbers in other countries. And I presume they also have a 501. We've got 501 V2, and maybe they've got 501 V1 or V3 or any of those to identify which country or where did they look at it. And I know this is very simplified, what I've now said. So, but this is not uncommon. And we will see the impact of this virus within the next 6 weeks. And then you can maybe look back again and say, this is what happened. This is, where it went wrong, especially with people not adhering to the protocols. Please, it is so important. I cannot stress it. We can talk about the rest of the family. We can talk about all the black sheep in the family. But if we do not do the right thing, we will not win this virus. We cannot simply wait for the vaccine so that the vaccine will solve all our problems. It's going to help us, but it's not the alpha and omega, not now.
All right, thank you very much for speaking to us, chairperson of the South African Medical Association, Dr. Angelique Coetzee, and of course